So welcome and thank you so much for being with us today at the 2022 Ohio Nutrition Incentive Network Annual Convening. We're so excited about this series of sessions and hope that you will join us to learn about the organization's projects and programs that create Ohio's local food system. You can still register for any session, and we'll share those titles and links to register to them in the chat now. We are beginning each session with a land acknowledgement, which we have sourced from the Ohio State University Office of Diversity and Inclusion. A land acknowledgement recognizes and respects the relationships that exist between Indigenous peoples and their ancestral and contemporary territories. We acknowledge that the state of Ohio occupies the ancestral and contemporary territory of the Shawnee, Potawatomi, Delaware, Miami, Peoria, Seneca, Wyandot, Ojibwe, and Cherokee peoples. These lands were ceded in the 1795 Treaty of Greenville and the forced removal of tribes through the Indian Removal Act of 1830. We would now also like to invite you to add your pronouns to your displayed Zoom name or put them in the chat box. If this is your first session today, we just want to share about the Ohio Nutrition Incentive Network, which is shorthanded OHNIN. We are a multi-sector coalition working toward a shared vision of affordable access to healthy local foods and a healthy, equitable, and resilient Ohio food system. We represent diverse regions of Ohio and collaborate to advance nutrition incentive programming statewide. We will be sharing a full contact list early next week with recordings and notes from all sessions. Today, OHNIN members have the OHNIN background that you can see on mine so that you can recognize and contact if needed. Our network is looking to expand and diversify. If you're interested in participating in OHNIN, please contact Anna Bird at Produce Perks Midwest. Her email will be added to the chat box now as well. So with that, I'm going to get into the content of our session. In this session, we'll be hearing from representatives of Ohio's nutrition incentive programs. Nutrition incentive programs are evidence-based models of increasing affordable access to healthy foods. Ohio's incentive programs are funded through federal, state, and local funding sources, and together create a stronger safety net for low-income Ohioans. Our presenters will each give you a 4-minute overview of their program, and then we'll have time reserved for questions at the end. Please feel free to put questions in the chat box as we go, and then we can answer them live during the Q&A. So first up, we're going to hear from Sarah Kuhns, Advocacy and Administrative Coordinator at the Ohio Association of Foodbanks, talking about SNAP.
Hi everyone, let me bring up my slide here. Thanks so much for letting me speak about SNAP today. My pronouns are she, her. So we as Foodbanks consider SNAP the first defense against hunger. We know that SNAP provides a lot of flexibility and autonomy for families, and although we provide choice in our food distributions, it can't get better than families going into their local grocery stores, infusing money into their local economies, and providing food for their families that they know they love and enjoy. So let's get a little into SNAP eligibility. So SNAP or food stamps considers both the recipient's income and assets as well as some of their expenses when determining eligibility. Household size is also considered when looking for benefit levels and what that household will receive each month in grocery money. SNAP serves Ohioans with gross incomes at or below 130% of the federal poverty level. And then caseworkers make determinations on the type of deductions that they would receive depending on certain expenses that the household has. Then this net income amount must be at or below 100% of the federal poverty level. For those who aren't eligible, and this has changed a little bit during the pandemic and will change after the public health emergency, but all people without a documented immigration status are ineligible, as well as some students attending college more than half time, as well as certain immigrants who are lawfully present. And then this is also another population that is subject to certain limitations as far as SNAP goes. ABODs or able-bodied adults without dependents. And I also want to acknowledge this is a really antiquated term and can leave a lot of folks out, especially when we're sort of dealing with long COVID and other invisible disabilities. But this population is unemployed adults aged 18 to 49. They do not have children on their SNAP caseload or on their SNAP case, and they do not have documented disabilities. This population is limited to 3 months of SNAP benefits over 3 years. Thankfully, Ohio had a statewide waiver throughout the pandemic so that this population could have more, a longer amount of time with SNAP. But unfortunately, as of October 1 of this year, only 8 counties have these ABOD waivers. You can see them listed on my slide right there. And then lastly, COVID has changed a lot for SNAP. The federal public health emergency is still in place, and we're unsure of when that will end, but it has opened the doors for SNAP for states to have more flexibility to meet the immense need during the pandemic. They have expanded and expedited SNAP online purchasing pilot. Although there are still challenges and some barriers for the populations that use this program, we have 13 stores in Ohio, 13 chains, I should say, that are allowing SNAP participants to order their groceries online. We also have expanded eligibility for full-time college students that will also end at the end of the PHE. But we are really looking towards the Farm Bill to see if maybe we could make that expanded eligibility permanent. And then lastly, but probably most importantly, is the SNAP emergency allotment. Now, each SNAP household is receiving the maximum allotment each month for their household size. So some folks are receiving $100, $200 when originally they were receiving $20 during the pandemic. And this is going to have some huge implications, you know, when the public health emergency ends. So I went through that really quickly, but if you have any questions, feel free to contact me or ask me at the end. Thank you.
Thank you, Sarah. Okay, and next up, we're going to hear from Erin Molnar, Data and Evaluation Manager at Produce Perks Midwest, about the Produce Perks program.
Hi, everyone. Thank you for joining us. Let me get my screen shared. I'm going to tell you a little bit about Produce Perks, which is Ohio's SNAP Matching Nutrition Incentive Program. Produce Perks provides a 1-for-1 match for SNAP recipients to purchase fruits and vegetables up to $25, stretching what they receive in SNAP for additional healthy foods. It empowers SNAP shoppers to make the choice for healthier foods, particularly fruits and vegetables, which are the healthiest. Produce Perks is funded by a USDA Gus Schumacher Nutrition Incentive Program COVID Response and Relief Grant, which is a mouthful. One of the program requirements of that funding is that the incentive is limited to purchases of fruits and vegetables. Produce Perks Midwest administers this at the state level, and then we work with a network of regional coordinators to facilitate the program for farm direct sites in their areas to leverage their local knowledge and relationships to maximize program impact and support program operators. Farm direct sites are farmers markets, which constitute the bulk of those sites, but also farm stands, mobile markets, farm stores, and CSAs. At farmers markets, most sites operate in this way. So a customer visits the farmers market information booth. They swipe their card with the market staff there to withdraw however much they would like to spend at the market in SNAP. And then up to $25 of what they take off that card, they receive additional tokens, Produce Perks tokens to be spent on fruits and vegetables. A few notes about programs at farmers markets and other farm direct sites. There are a few markets that use different models. Farm stands, farm stores, CSAs, and mobile markets offering Produce Perks often use a discount instead of tokens. The Produce Perks tokens themselves can be spent at any participating market. Those SNAP tokens are usually restricted to the market where they were purchased. The Produce Perks tokens don't ever expire, and you can also use them on food-bearing plants and seeds. Here's a map of all of the farm direct locations that offer Produce Perks in 2022, color-coded for locations that are seasonal and those that operate during the winter as well. We're in October, so seasons have either ended or are winding down. We also offer the program at grocery stores. This is very general, but typically a customer shops using their SNAP card. Similar to the market program, they receive up to $25 a day, and they generally receive a coupon. Again, there are some varying models that allow us to be responsive to community needs as well as store and POS systems. In some stores, we match all SNAP purchases. In other cases, we only match produce purchases. And then the currency that they receive varies. Sometimes it's a Catalina coupon, which is one of the automatic coupons that a cash register prints. Sometimes they're pre-printed coupons. Sometimes it's a discount, and sometimes we've been able to integrate with a loyalty program. And also a note that specifically the days locations in Cleveland and Akron only match up to $10. This map highlights grocery retail locations. The counties in the red are stores, or we're working with stores there to onboard the first retail location in those counties. Some brief numbers on impact, which I will let you look at after this presentation. But just noting that year to date, we've seen incredible increase in program use. And then just some information about how you can plug into this incredible program by sharing information with customers. You can also share information with markets and stores in case they might want to participate. If you have a recommendation, you can also email Anna and she can reach out to them. And then, of course, advocacy to local, county, and state level bodies to support Produce Perks funding. And for more information on that, you can contact Tevis. That was fast.
Okay, awesome. Thank you, Erin. And next we are going to hear from Debbie Serenius, Director of Health Partnerships with Produce Perks Midwest, about produce prescriptions.
Good afternoon, everyone. I'm going to be talking about our produce prescription program, but also prescription programs in general. Let me reduce that. So what is a produce prescription program? Well, we call ours PRX at Produce Perks Midwest, and that is a tongue twister, all those P's. We should have thought of that. These prescription programs allow clinicians to provide monthly monetary fruit and vegetable prescriptions to nutrition insecure patients with diet-related disease. The little graphic on this slide shows the PRX process. It's patient-facing, so this explains the process to the patients. So once we've partnered with a clinic, that healthcare provider will ask the patient to join. They will meet them monthly to provide nutrition and other healthy lifestyle education, as well as give them their prescriptions for the month. That patient can then spend those prescriptions at participating markets and grocery stores. But the prescription voucher is not the only method that we can provide produce to these patients. The prescription voucher is shown below on this slide, and they're in $5 increments, but we also can do delivery, and deliveries can come from a local farm CSA or a retailer. And on top of that, the deliveries could be delivered to the clinic for the clinic to disperse to patients, or we can also deliver straight to the patient home. Increasingly, we are seeing a lot of our programs choose a hybrid method, and that's where perhaps they get one delivery of produce each month, and then we also give them vouchers to spend at participating stores. The picture on the right hand of the screen is our Findlay Market partner packing a produce box for a patient. We have three main goals in our produce prescription programs: to improve the nutrition security, food literacy, and the health metrics of those participating. We believe it's a big investment in the patient and their family. As an organization, we made the decision to provide enough produce for that patient and their entire household to meet the recommended daily servings of fruits and vegetables, which equates to about $30 per household member per month. We also believe in strengthening the patient and provider relationship, because we know if that is strong, they're likely to be healthier. Some of the additional patient engagement opportunities that we offer currently, and these are unlimited. If you're thinking of doing your own program, we offer cooking demos with provided meal kits, cooking tools, farm tools, and farm tours, and meet the farmer encounters. Well, if all this sounds good and you're considering a prescription program, here are some considerations. So the benefits: it's a flexible program design. You can really get creative. We're able to reach low-income Ohioans that may not qualify for other food programs. We're able to target members of your population that align with community health plans. This deep investment of healthy food, nutrition, and health education, and strengthened patient-provider relationships can be impactful and leave lasting results to individuals. Some barriers to consider is that it is an expensive program. The staff involvement is extensive for both your organization and the clinic, and the data collection can be challenging, but it's definitely worth the investment. So what can we envision in the future for these programs? Well, hopefully working with insurance payers, seeing Medicaid funds allowable for use, looking to digital card technologies, as well as medically tailored meals. The future is really bright.
Great, thank you so much, Debbie. And next up, we're going to hear from Farrell, Program Coordinator with Produce Perks Midwest, about the Tana Fruit and Vegetable Coupon Program.
Thank you, Jenna. As Jenna said, my name is Allie. I'm a program coordinator with Produce Perks Midwest. I'm very honored to work with Produce Perks Midwest, as well as other statewide partners, to bring these programs to those who need it the most. Today, I'm going to talk about the Tana Fruit and Vegetable Coupon and Delivery Program. It is funded under the state budget, the amount of $1 million, and the project period is from November 2021 through June 2023. As a shared goal with all of these programs, we are looking to enhance nutrition security for the purchase of fresh, healthy produce from Ohio farmers and retailers for TANF eligible families in this program specifically. The program goals are to increase fruit and vegetable purchases among TANF eligible families. It's also to increase the use of the Produce Perks program among TANF eligible families who also receive SNAP benefits and may not already be aware of that program, and also reduce burdens on TANF eligible families in accessing fresh produce. So you may wonder, who is a TANF eligible family? Families with household income at or below 200% of the federal poverty level. They must have minor children in the household and or be pregnant, and is a US citizen or meets one of the citizen exceptions under the Ohio Administrative Code listed here. An individual signing up and their family must meet all 3 of these requirements in order to be eligible for the program. So you may wonder what the TANF fruit and vegetable coupon program is. This program, TANF eligible families receive $240 in fruit and vegetable coupons that can be spent at participating farmers markets, mobile markets, and grocery stores. The coupons are distributed by partners across the state or at market distribution events. At these market distribution events, we also have cooking tools that we're able to give to the enrollees, as well as children's activities for those who come up to the table to sign up to keep the little ones occupied while their parents are completing the form required. The TANF coupon program impact between February, which is when the program launched in 2022, through July, which is what we currently have the data for, was $439,200 was distributed to TANF eligible families in over 39 counties across Ohio, and $160,281 were redeemed by the enrollees between the period of February through August 2022. You can see right here, this is a picture of the TANF fruit and vegetable coupon, so similar to the PRX coupon that Debbie shared. The beautiful, bright design. And now I'm going to talk about the fruit and vegetable delivery program. So like the PRX program, we have multiple ways to roll this program out. TANF, in the delivery program, TANF eligible families receive weekly or bi-weekly deliveries of fruit and vegetables for up to 16 weeks. We work with different partners across the state, which I will mention here shortly, as well as farmers and retailers in order to provide the deliveries. And an interesting partnership we recently developed is working with DoorDash to actually deliver some of the produce items to individuals' households. The delivery program impact, we signed up over 624 TANF eligible families from 14 plus counties in Ohio, which received these program deliveries from February, or sorry, they were signed up between February and August 2022. You can take a look at some of the partners we are currently working with. So you can see the coupon distribution partners here on the left. We really appreciate the efforts of these partners to get these resources out there into their communities. And then here on the right, you can see the delivery CSA partners that we've worked with in order to provide the deliveries, as well as the farmers and grocery stores as well. This list does not include all of the farmers markets that allowed us to come to distribute the coupons at their markets. It's always a joy to visit markets and be on the ground and get to engage with the individuals that we're serving through these programs. If you would like more information about the TANF fruit and vegetable coupon program and/or delivery program, you can reach out to me. My email is allison@produceperks.org. You can also visit our website, where you can find information about Produce Perks, Produce Prescription, and TANF fruit and vegetable coupon programs, all listed there. Thank you so much.
Thank you. And next up, we will hear from LaVelle Betts, Manager of Community Relations at Buckeye Health Plan, talking about Buckeye Fresh.
Good afternoon, everyone. Thank you for inviting us out. I'll just give a brief overview of our, what we consider one of our great programs here at Buckeye, which is our Buckeye Fresh. Kind of give you some of the goals and the program that we have here at Buckeye. Social determinants of health, as you know, is one of the biggest drivers that we have here at Buckeye. And part of our vision is that we are not just looking at the individual, but we're looking at the individual as a whole. Part of our community focus is really surrounding food insecurities here in Ohio. As you see on the screen, Ohio's number 14th in the nation for adult obesity. Part of our response for food insecurity and talking with our members is that with programs like this, to where they're able to purchase fresh produce at the markets. Buckeye Fresh, actually our Buckeye Fresh program is just access to healthy, affordable foods is one of the key determinants of health. It remains a challenge in many of our low-income communities. Again, Buckeye is committed to transforming the health of the community one person at a time. As part of that commitment, Buckeye is partnered with Produce Perks with Healthy Food Initiative Program to raise awareness about these issues and the help of those with limited income. As you see that Ohio is still struggling with hunger here in Ohio. And some of the other things that beyond the numbers that we have learned with the Buckeye Fresh things that we do is that we are learning that people still, food insecurity is still important for a lot of our members, and not just our members, but around the state. Also at our Buckeye Fresh, we was able last year to partner with Walgreens to do COVID-19 shots. We also hand out recipe cards to any consumer that attends the Buckeye Fresh, the markets that we are in. We have a treasure hunt for the kids also that attend the Buckeye Fresh with their parents. Buckeye Fresh, basically our members will receive a $10 voucher for free fruits and vegetables. Also, I just mentioned about the kids will receive what we consider a Buckeye Buck, to where they get to experience shopping with their parents at the market. SNAP and EBT also match $1 for $1 up to $25 with Produce Perks. The $240 in Tana vouchers for qualifying families. Just a quick story on that. Met a young man in our Cleveland market this year. He's a Buckeye member. He also qualified for the $240. He just stopped back over at the tent and said, thank you for the dollars that he received that day. That would take him through the summer for him and his family. So these $10 that people that qualify for is very important. We started this program 5 years ago, and we expanded it with this initiative with Produce Perks for fresh fruits and vegetables. As you see on the screen, at this time, we served over 2,500 of Buckeye members. Just here are some of the numbers. We started this pilot thing in 2018. We served on our first go around as 275 members. Just to let you know, on this day, I know Anna and Tevis remember this, it was pouring down raining the whole time we were there, but just to show how important people need these vouchers and food insecurity, they actually waited all day, even though it was pouring down raining. 2019, we expanded our program from Toledo. We also expanded to Cleveland, the Cincinnati and Dayton market in 2019. So we served 473 Buckeye members. In 2020, we served 585 of our Buckeye members. And this year, we actually expanded to 2 more regions in the Portage County and also the Akron area. So we was able to serve 1,254 Buckeye members. So again, we feel that this is very important that we hear from a lot of our members and also through the community. Here's one of our members here. As you see, she's holding the voucher in her hand. We actually send out texts to our members. We also send a postcard to where within that market where we will be set up at the farmers market within a 3 to 5 mile radius. Our members will receive a postcard. And as they come to the market, they will check in, and they also will receive what she has in her hand is a Buckeye booklet that each of our members will receive. Also, those vouchers are good until the end of the farmers market season. So if they don't use them that whole day, that day they're at the market, they can come back the following week or until the end of the market to use their vouchers at the markets around the state. And that's all I had. If you need to learn more about Buckeye Fresh, please visit buckeyehealthplan.com and the community outreach page. Thank you.
Great, thank you, LaVelle. And next up, we will hear from Kadie Donahoe, Program Administrator at Women, Infants, and Children, or WIC, talking about the WIC Farmers Market Nutrition Program.
Hello, everybody. I'm Kadie Donahoe, and I am the program, as she said, the Program Integrity Supervisor for the Ohio WIC program. And as part of that, I also oversee the Farmers Market Nutrition Program. So I'm just going to talk briefly about WIC and then go into about the Farmers Market Nutrition Program. So for those of you that aren't familiar with the WIC program, it is a special supplemental nutrition program for women, infants, and children. And we're in all of Ohio. So we're statewide, and what we do with WIC is we provide nutrition education, breastfeeding support, supplemental nutritious foods, and referrals to other healthcare and human services programs for pregnant women, postpartum women, breastfeeding women, infants, and children up to the age of 5, who all are income eligible and who have a special medical or nutritional risk. So in Ohio, we serve about 165,000 participants per month with the WIC program right now. Or they might just accept them at a organized farmers market. And then we also have 54 contracted markets. So for those of you who are familiar with Findlay Market, they're one of our contracted markets. They are responsible for accepting, redeeming the coupons from the farmers and oversee the program at their entity. Our local WIC clinics are obviously a huge part of the success of this program. What they do is they actually distribute the coupons to the participants. They provide the nutrition education on fruits and vegetables. As far as the distribution of coupons, they can do it. We leave it up to them, how they decide to do that. They can do it through clinic visits, or the majority actually visit a market and distribute right at the market, and the participant turns around and goes and spends the coupons at the farmers. That's the optimal way to do it. Or even better, a lot of our clinics will set up special markets where they'll have the farmers come to the clinic and then distribute coupons there and have other programs from the agency involved. So like car seats or COVID tests or just any other health program there for the participants to get there involved in those other programs. And then in addition, our local clinics also train our new farmers and conduct the farmer required visits at the sites. We average about a 68% redemption rate. That's money that's going into those farmers' pockets right away. That is higher than the national average, at least the last national average I could get my hands on. It's about 12% higher. So we're very proud of that. And obviously all that credit goes to our local WIC clinics. So once the farmers accept the coupons, then they send those to us at the state WIC office, and we process those for payment. And then the payment goes directly to those farmers or those markets. And I'm trying to kind of minimize this because I know we're behind on time. So with that, I guess if you put in questions in the chat or if we leave them till the end, that's what I have for you. Thanks.
Thank you so much. Sorry about the interruptions with the recording there.
No
it is restarted. Okay, so next up, we're going to hear from Amanda Osborne, Community Development Extension Educator at The Ohio State University Extension, telling us about WIC incentives.
Thanks, Jenna. So I have about 4 minutes or less to do this, so we're going to do this really fast. So WIC Perks is a model that's been around for about 4 years now, and it's a way to incentivize WIC FMNP. So we do this in partnership with Kadie and our local WIC office. So what is WIC Perks? It's an incentive program that we offer to FMNP recipients on select FMNP distribution dates at farmers markets. So not all events, select ones. We partner with our local WIC office and local farmers markets. And this is currently funded by local foundations. So there are no state or federal funds that are currently available for this type of work. But families who attend these select dates will receive an extra $20 in fruit and vegetable coupons and some culinary tools. Also during that time, they will be introduced to the Produce Perks program in the event that they are also receiving SNAP benefits. So I just want to kind of talk about the context that brought this project together. There was definitely a great opportunity to, one, expand Produce Perks, but also enhance the existing WIC program that was very successful in our county. So WIC had been using a texting service to remind clients about FMNP distribution events. That was very successful. So record turnout, you would see wonderful lines at the market, and we really wanted to kind of build off of that. So we approached our WIC office and said, hey, can we partner? How can we offer additional incentives to FMNP clients in the county? And so in 2018, we came together and we decided to work on that so that we could connect those WIC FMNP recipients to the Produce Perks program through this, this little bridge we call. So this is kind of how the program works. So WIC will set their FMNP schedule each season, and we work with them to identify 8 dates where we're going to partner. So you'll see there's 8 dates highlighted in green font. That's when we do WIC Perks events. So they'll actually give this schedule to their clients, and the caseworkers will let the clients know on the green days is when you get the bonus. So it is WIC Perks, but we also call it the green days. That's how it's kind of affectionately known. I just want to mention that all of the promotion for this additional incentive is done by the WIC office. Extension does not do any promotion. They do this directly with their WIC schedule on the screen. So what happens is a family will go to the farmer's market that day. They'll check in with WIC. They'll get their FMNP vouchers, and WIC will give them a little white card. You'll see a picture on the screen on the left-hand side. We call this a referral card. So what this allows the families to do is to come to our tent and hand us that card. And they don't have to tell us they're receiving WIC, right? It provides some anonymity. We just know that they're a WIC recipient. And if they participate in either a quick taste test, nutrition education activity, cooking demonstration, whatever we might be offering that day, in exchange for their participation, they get an extra $20 and they get to take home 2 culinary tools. So this is just what the coupon kind of looks like. They're not amazing. I'm not a graphic designer, but this is what I have whipped up over the years. But they are distinct from the FMNP coupons, and they have instructions specifically for the vendors on the back. So what has happened over the last 4 years is we've served over 2,200 families. We've funneled over $23,000 into the pockets of small farmers across 32 events. And some key themes have kind of come out in our data. The first is that WIC Perks truly does act as a bridge between FMNP and Produce Perks. So we see increases in utilization and awareness of Produce Perks among WIC FMNP recipients who come to these events. We see record SNAP sales at farmers markets on dates where WIC FMNP is there, along with WIC Perks. And then we do see significant increases in distribution on dates where that bonus is offered. So the highest distribution dates for WIC FMNP are the dates where the bonus is offered. So there are other WIC incentive models in Ohio. WIC Perks is not the only one. There is Carrot Cash that's also offered by Countryside in Summit County, and Haymakers Farmers Market has recently done a WIC Perks adaptation locally in Portage. So WIC incentive models are super fun. I think they're very flexible. Like Debbie said, prescriptions are flexible. I think WIC incentives are just as, if not more, flexible. So you can really tailor it locally based on your funding, where the capacity lies. So the amount of the incentive can vary, how the incentives are distributed, or the frequency. There's just a lot of flexibility there. If you have any interest in doing a WIC incentive model in your county, feel free to reach out to me, Kadie. I know Andrew Rome is on here from Haymakers, Jenna, who you can see on the screen, and Erin Molnar. We've all got some experience in WIC incentives, and we'd be happy to chat.
Okay, great. Thank you, Amanda. And next we have up Autumn Trombetta, Population Health Program Administrator at the Ohio Department of Aging, who will tell us about senior farmers market nutrition programs.
Hi, everyone. My name's Autumn Trombetta, and I'm going to try and attempt to share my screen without my notes. We use Teams, so here we go. Oh, any luck?
It does show the notes. Oh, there we go. That looks right.
Okay. Uh-oh. All right, well, great. Now I don't have notes. So I'm Autumn Trombetta. I'm the Population Health and Nutrition Program Manager here at Ohio Department of Aging. I oversee Older Americans Act Title 3C, which is nutrition services, Title 3D, which is like evidence-based programming, which would include like Tai Chi and bingo size and chronic disease management, self-management programs. And then my third role is Senior Farmers Market. And then of course, other duties as assigned. So the way Senior Farmers Market works, Kadie talked a little bit about Ohio WIC. So Senior Farmers Market comes from USDA's FNS program. It's paid through the Farm Bill, Educator Area Agency on Aging. Okay. As you can see here, we service 82 of the 88 counties with our dollars. We do get about 1.4 million from the federal USDA, and then the state also applies about 660,000 additional dollars. To be eligible for the Senior Farmers Market, you must be at least 60 years of age, you must live in one of those 82 counties, and you must have a household income not more than 185% the federal poverty level. These benefits, like many others, are provided through a coupon based. We give out 10 $5 coupons. During the pandemic, we were having a lot of trouble getting older adults out into farmers markets. So not we, but a lot of our local agencies turned to this produce box. And it also assists those local regional agencies in utilizing all of their grant funds too. So at the end of the season, they can provide $50 produce boxes if their redemption rate happens to be low. I should also add that seniors are allowed to name 2 proxies. So if you have a homebound senior who was unable to actually attend the farmers market, you can mark that on your application, and up to 2 proxies can get the food for you. Also, farmers, all of this happens at the regional level. So applications are processed through the local AAAs or their identified partner, and the farmer contracts and payments go through them also. We, despite challenges, had continued success in 2021. We had over 44,000 participants. We had over 400 farmers, 47 market managers, and 265 farm stands. We just got our monitoring reports for this year, and we hope to surpass those numbers also. I also wanted to mention that we do have a farmers market recipe book that is available in non-English speaking languages. It's available on our website for download, for print. That was through a great partnership with Ohio Department of Health that we got all of those translated. And here is my contact information. Shall you want to partner or connect further?
Great. Thank you so much, Autumn, and all of the presenters. It was great to hear about all of the programs, and we're going to open up for questions now. I did see some coming in through the chat. You can feel free to put more in the chat or to raise your virtual hand, and then we'll call on you and you can unmute and ask a question. I know that there were some that had come in through the chat. I'm not sure, Anna, if you had seen those. Okay.
Yeah, I did. Yeah. So this first one is, or first 2 are for the PRX program, the produce prescription program. So For the PRX program, it was stated that low-income people that are not qualified for other food programs may be eligible. Debbie, could you clarify that a little bit?
Sure, yeah. So you've heard from some of these different programs like SNAP or, the senior programs that there are qualifications, put out either federally or by the state as to, the percentage of like the FLP or income requirements. The nice thing about the prescription program, and this depends on the funder, that those, you don't have to hit a lot of those. So if you have funding for a prescription program, you work with eligibility requirements with that funder so they can be more flexible.
Great, thank you. And one more for you while we have you up. The term clinic was also used a lot. Is there a clinic you specifically coordinate with or for this, or does someone need to be seen at that particular clinic? If so, do they coordinate with other local PCPs?
Great question. In 4 minutes, you miss a lot of definitions. So when I was referring to clinic, that's in air quotes, right? So it's any healthcare partner that you partner with to run a prescription program. So currently we're operating about 15 prescription programs, and they're with varied healthcare clinics. So we work with hospital systems like Mercy Health or Cleveland Clinic. We work with FQHCs, which are federally qualified health centers. We have worked in the past with individual physician offices. So again, the funding sort of determines, where you look for partners, but every prescription program can, have a different partner as far as a healthcare partner.
All right, thank you. And then for Autumn, where are the AAAs located?
Yes, there are 12 regional area agencies on aging, and I put a link to the map
I see.
into the chat.
Great,
Great
thank you.
question.
All right, and then another prescription program question. For the PRX program, can farmers markets become eligible redemption sites for existing nearby programs, or does each program have to have a one-to-one relationship between the healthcare provider?
Good question. Any farmers market that's already a Produce Perks participating site can definitely be considered. What we look at is proximity to the clinic, as well as where the majority of the patients are living. So yeah, we don't have to limit it to one farmers market. We love for patients to have several redemption locations. It just makes it easier and more likely that they're able to redeem vouchers. So yeah, if we have a program in your area, I'm not sure where the question came from, we would be glad to consider having you be a redemption site.
Great, and one more question. So Dan has asked if electronic coupons were mentioned, maybe by any of the speakers. If anybody wants to tackle that one.
This is Autumn at Ohio Department of Aging. We do not have, we have not ventured in that space of electronic coupons at this time. We still use a coupon paper method.
Right. And this is Kadie from WIC, and we also have not ventured that way. And obviously one of the things to do with that is funding. We're very limited in admin funding, and the cost of going electronic would be much more than our grant right now.
And one final question, unless folks have others, but we will wrap up here in a couple of minutes. Can people participate in multiple programs simultaneously? Jen, I don't know if you want to answer that one maybe.
Yeah, so most of these programs, yes. In fact, I think all, I just don't want to misspeak, but just depending on eligibility, if you're eligible for multiple programs, you can certainly use them at the same time. Does anyone have, I think we went through the chat. Oh wait, there's one more coming in. So are the senior FMNP going to go to a whole market approach, or is the program based on a per farmer redemption?
Well, right now it is per farmer redemption. Can I throw my email in the chat? Because this is my first market season, and I just attended a national conference too, and like the wheels are spinning. So I have like all of these ideas of how we can improve our services, and I would love to learn more about a whole market approach. I'm assuming that's from a market manager standpoint. So please contact me.
Yes, thank you, Autumn. Okay. I think we should probably close out here to get everyone to their next sessions if they need to. So thank you again so much for joining us today. If you do have any more questions, we will be sending out contact information. We hope you found this session informative and inspiring, and that you'll join us for more throughout the afternoon. We're going to add the sessions again to the chat so that you can still register for any more that you might want to attend. If you have trouble registering or accessing any of those sessions, you can contact Dana Johnson with Produce Perks Midwest. Her email will also be added to the chat. And if this is your last session of the day, we thank you so much for sharing your time with us, and we'll be following up next week with recordings, notes, and contact information. And we hope you've been inspired by what you've heard today and look forward to connecting further. Thank you, everyone.